will be talking about trajectories of force orthodontics. It is an essential concept that helps us understand how teeth move under applied mechanical forces. Every orthodontal tooth movement results from a force applied to the tooth, and the direction, magnitude and point of application determine the trajectory or path of movement. In 1867, George Hermann von Meyer proposed the trajectorial theory of bone formation. This theory states that the lines of orientation of the bony trabeculae follows the pathway of maximal pressure and tension. Trabeculae are actually lines of maximum stress within the bone. Most of the trajectories cross at right angles, an excellent arrangement to resist the many stress on the bone. In 1870, Julius Wolff gave the reason for arrangement of trabecular pattern. Simply states, stress of tension or pressure on bone stimulate changes within the bone. Bone is one of the hardest material in the body. Mature bone consists of compact and spongy. Benihon states that stress trajectory or lines of orientation of the bony trabeculae involve not only the cancellous bone but also spongy bone. Trajectories of maxilla. Maxilla consists of bones and plate along with support of bony thickening. These are called buttresses. Buttresses are nothing but stress-bearing area. Maxilla consists of vertical pillars and horizontal reinforcing members. Vertical pillars involve first one, frontonasal vertical pillar or canine pillar, which runs vertically along the piriform aperture and crest of the nasal bone and ends in the frontal bone. Second one, zygomatic vertical pillar, which transmits stress from posterior teeth. Third one, pterygoid pillar, which runs vertically from the concave nasal cavity and posterior teeth. Horizontal reinforcing members. Supraorbital rim act as a receptor of forces from canine and zygomatic pillar. Others are infraorbital, zygomatic buttress, hard palate, walls of orbit, and lesser wing of sphenoid. Trajectories of mandible. Trabecular column originates from beneath the teeth in the alveolar process and join together into a common stress pillar. Mandibular canal and nerve are protected by this concentration of trabeculae. Lower border of mandible offer high resistance to bending forces. Trajectories are also seen at the symphysis and gonial angle. One trabecular pattern is seen running downward from the Carnot process into the ramus and body of mandible. Accessory stress are due to the effect of muscle attachment. Thank you.